Hello, my name is Ethan Tidwell, and I am a third-year physical therapy student, and I am representing the LSU Shreveport Physical Therapy Program. Today I will be talking about physical therapy and its role in healthcare. I will go ahead and apologize for my country accent, but I assure you I have a good tooth-to-tattoo ratio consisting of 32:0. Physical therapists provide services to restore function, improve mobility, relieve pain, prevent or limit physical disabilities, and promote overall health and fitness. The American Physical Therapy Association vision on the human experience states this: transforming society by optimizing movement to improve the human experience. Physical therapists interact with patients in a variety of settings such as the ICU and NICU, inpatient and outpatient facilities, long-term acute care, assisted living and nursing homes, patient's home environment, sporting events such as high school and the Shreveport Mudbugs hockey team, and exercise gyms. Physical therapists provide a multitude of services to patients, which includes but is not limited to strengthening and increase of soft tissue viscoelastic properties, cardiovascular endurance, wound care, manual therapy, neuro re-education, women's health, prophylactic treatment to reduce any occurrence of injury, evaluation and correction of faulty biomechanics. We are also well educated in potential yellow and red flags when performing treatment, patient education on the importance of wellness, and improvement of patients' quality of life and functional outcomes. To gain entrance into physical therapy school, you must attain a bachelor's degree or participate in a 3-in-3 program, which consists of 3 years of undergrad and 3 years of physical therapy school. As far as physical therapy school goes, it is a 3-year program which grants you a doctorate of physical therapy. Although a doctorate of physical therapy has been the only degree program available for the last 2 decades, previous licensed physical therapists may have also graduated with a master's degree. This is a brief overview of the DPT curriculum. 80% of it is didactic, including courses such as anatomy, cellular histology, physiology, exercise physiology, biomechanics, kinesiology, neuroscience, pharmacology, pathology, behavioral sciences, communication, ethics and values, management sciences, finance, sociology, clinical reasoning, evidence-based practice, cardiovascular and pulmonary, endocrine and metabolic, and musculoskeletal. 20% of it is also clinical education, consisting of approximately 27.5 weeks of rotations. After you attain your doctorate of physical therapy, you can also further your education by participating in clinical residency, clinical fellowship, and attaining a specialty certification. This includes cardiovascular and pulmonary, clinical electrophysiology, geriatrics, neurology, orthopedics, pediatrics, sports physical therapy, women's health, and wound care. Starred above are neurology, orthopedics, and wound care. These are starred because these programs are offered here at LSU Shreveport, and wound care is also starred because we are the only program in the whole nation who offers this. The future of physical therapy includes unfettered direct access to patient care nationwide. Recently, Louisiana passed a law which allowed physical therapists to see patients with direct access, not requiring a physician's referral. However, for many other states in the nation, they are still restricted and require a referral. We also want the ability to order imaging into our Practice Act nationwide. Physical therapists in the military have been able to order x-rays for years, and in 2016, Wisconsin passed a law which enabled all physical therapists with a doctorate to order x-rays for their patients. Allowing physical therapists to order x-rays takes a step out of the equation and saves the patient and healthcare system money and time. We are also well trained to know when to refer to a physician when red flags become apparent. We also want to further public awareness and education and prescribe certain medications. As the leading healthcare provider for musculoskeletal disorders and the amount of training we now receive as doctorates, it would seem as though only a matter of time before physical therapists are allowed to prescribe NSAIDs for pain relief and swelling reduction during an acute stage of injury. Physical therapists use a wide variety of tools such as goniometer, tape measure, TheraBand, weights, and the Balance Master. Physical therapists use a variety of tools such as a goniometer to measure range of motion of the joints, a tape measure to measure girth, and also TheraBand, weights, and a Balance Master. These tools also include various tapes, a bodyweight supported treadmill, orthotics, and assessment tools. Bodyweight supported treadmills allow a safer return to walking and ambulation. As physical therapists, our most important tool is our hands. We use our hands in modalities, massage, and manual therapy techniques. Lord, protect our CMC joints. Amen. Next, we will discuss 3 common conditions physical therapists treat. One being sciatica. Common symptoms of this include pain, numbness, tingling, or burning anywhere from the low back down to the hip, leg, or even the foot. These symptoms can cause trouble with walking, sitting, or performing daily activities. Sciatica can arise from a disc bulge or herniation, inflammation, or irritation along the sciatic nerve root, resulting from a compression injury to the buttocks region, or due to tense or tight musculature. Treatments for this include neurodynamics such as nerve flossing, gentle stretching, spinal mobilizations, or myofascial release techniques. Another condition includes congestive heart failure. Common symptoms include shortness of breath, pleural effusions, fatigue, peripheral edema, weight gain, and irregular heartbeat. Physical therapy has an important role in acute care settings. Physicians order physical therapists to evaluate and intervene with strengthening and range of motion exercises to prepare patients for their recommended discharge from the hospital. In addition, recommendations for physical therapy outside the hospital after discharge is common and may occur in settings such as rehabilitation facilities, outpatient clinics, and home health. Treatments include aerobic exercise, resistance training, energy conservation techniques, activity tolerance education, and cardiac diet reinforcement. The third and final example we'll give today is cervical radiculopathy. Common symptoms include radiating pain from the neck to the shoulder, scapula, arm, or hand, sharp pain, pins and needles pain, or popping sensation in the cervical region, dull ache or numbness, and pain that worsens with certain neck movements. Cervical radiculopathy can arise from arthritis or wear and tear of the disc from degeneration, herniated or bulging disc from trauma or degeneration, spinal stenosis, or a tumor. Treatments include pain management from modalities, manual therapy, ergonomics assessment and education, taping, cervical and shoulder range of motion, PNF patterns, and strengthening of the neck, shoulder, back, and core. The patient information from the case study describes a 42-year-old white female with a previous medical history of hypertension, type 2 diabetes mellitus, smoking, alcohol abuse, and morbid obesity. Her occupation is an account specialist for Teleperformance in Shreveport and has a social history of high stress, poor diet, sedentary lifestyle, and she is married and lives with a 20-year-old daughter. The patient presents to the emergency room with stroke symptoms. Acute physical therapy treatment for stroke would include positioning and weight bearing to minimize the effect of abnormal tone, maintenance and progression of range of motion, bed mobility, transitional movements, and seated and standing balance, cognitive and communicative retraining, and increased level of consciousness by sitting the patient up and raising the head of bed. Acute physical therapy treatment for stroke also includes the checking of coordination, gait training, assessment for assistive device, patient education on lifestyle change to decrease risk of future complications, and education on signs of stroke, which includes FAST, facial drooping, arm weakness, speech and slurring, and if these three characteristics exist, then it's time to call 911. This has been a presentation describing the characteristics of physical therapy and our role in healthcare. Thank you for your attention, and if you have any question at all, do not hesitate to contact Michael Bass and he will answer any question that you may have. Thank you.